Namaste everyone. Welcome back to live stream sessions. So today we are discussing or I am speaking about the topic Sutika paricharya, that is the postpartum care or we can say post-delivery care. As we discussed Garbhini paricharya yesterday. So next coming stage is Sutika, right? That is after delivery, what all care and how we can care a woman after immediately after delivery and how diet we should maintain, what all activities we can do, and how we should care them. We will see today. So, as we all know, we will be having many changes during delivery because we will be having many changes, hormonal changes maybe, or overall physiological pattern. Every changes will happen in pregnancy and during delivery too. Many changes will happen. But so for these all reasons, we need to care a woman after delivery. But actually, what will happen? Immediately after delivery, our full concentration will be on new member, baby, right? So all will be busy in caring a newborn baby. So in one or other way, we will neglect ourselves or we will neglect mother because all concentration will be on new person. It's obviously when new person entered a home, all concentration will go through it. But with that, we should care ourselves also, or we should care delivered mother also, right? So what all care we should take and how our Ayurveda, what all Ayurveda mentioned about taking care of newly delivered women, we will see. According to our Ayurveda, we need a 45 days care. Like 45 days, we should care. Some particular activities or particular diet they mentioned. For 45 days, we should care a newly delivered mother. According to Ayurveda, our acharyas explained that during delivery, all the doshas of a mother will hamper. It will be vitiated or hampered or aggravated or subsided. It will all doshas will be hampering. With that, our digestive system will become slow. So obviously, especially in three doshas, Vata dosha will be aggravated. So usually in this 45 days, what treatment we will give is one thing is Vata Shamana treatment they explained, and another thing has digestive system will be low. Obviously, Pitta dosha will be subsided. So they advise Dipana Pachana drugs with Vata Shamana, Dipana Pachana, and with this obviously lactating drugs, and obviously the mother will be very sensitive to and prone to diseases. So fumigation like Dupana drugs, these all they advised in our Ayurveda. So how our daily routine should be according to Ayurveda, as I explained, Vata dosha will be aggravated. So to make it Shamana, Vata Shamana, one thing the daily routine our Acharyas explained is Abhyanga. What is this Abhyanga? Massage, body massage with any taila, like maybe Bala taila, Mahanarayana taila, Kshira Bala taila, or none other than coconut oil. That is, with these basic oils, we can massage a whole body of a mother, delivered mother. But how the massage should be? It should be gentle, with not any pressure or more pressure. Gentle massage should be done. For what it will make? Obviously, as we massage, there will be Vata Shamana. It will create the Vata Shamana. And followed by Abhyanga, either they can take Svedana for whole body or they can have a warm water bath. In warm water bath also, it should not be too hot. Comfortable or tolerating capacity of the skin, they can go for the warm water bath or Svedana. Svedana, how they can do? Like if you're doing this in a home only, then you can take a bowl, you can make a charcoals or any like cow dungs fire thing, and you can take that fumes. But our acharyas in this dhupana also, like in Svedana also, by doing this dhupana fumigation, they added some this dhupana drugs to fumigate an environment of a mother and to fumigate the baby, and it will be preventive of infections also. And after this, they explained Yoni Dhupana. What is this Yoni Dhupana? Especially, as I mentioned, you can take a ball and you can make a fumigation in that. how we will do dhupana for puja samagris like that, but ingredients are separately mentioned for dhupana drugs here. What you can do, you can wear a light cloths and you can give this fumigation to your vaginal area. Why we should do this? Obviously, it will create the antibacterial and antimicrobial, because as I mentioned, this newly delivered mother will be more prone for diseases. They will be very sensitive. So we are we are preventing the infections, one thing. And if vaginal delivery, if the mother woman is having episiotomy stitch, then it will be healed soon by the fumigation. So we can give the Yoni Dhupana. And next thing is Udara Veshtana. Udara Veshtana is nothing but tying a belt for the abdomen. Now we have the belt, we can tie them. But in olden days, they were not having these belts and all, so they were using a cotton cloth to tie. In this tying also, what our grandmothers or any elders will do, you should tie it very tightly, so that then only your muscles will go inside back to their normal position. Nothing like that. Actually, what will happen here, why they will tie these cloths or abdomen belt, why they will give in pregnancy. However, we know our muscles, everything will be enlarged, ligaments, everything will be enlarged, right? So to make them in a normal position, they will say you should tie the cloth or belt to a abdomen. You should tie, no, you should not tie it very tightly. You can tie it on your comfortable way. Because of tying up in a position, they will go to that normal position as soon as possible. That's it. Then these are about the activities according to our Ayurveda. What about diet? What all you can give or what all you can take? First of all, as I mentioned, digestive fire will be slow. Digestive system will be very slow. So you should have light foods. Light foods means what all you can have. First of all, you should not have any packed foods or reheated foods. We should have fresh foods. And the light foods means which are easily digested. Like you can have in the form of ganjis, semi-solid foods. Instead of having solid food, you can have in initial stages, like some 30 to 40 days, you can have light foods or in the form of semi-solids, or you can have rice ganji. The rice upper part, what we get, the watery part, white watery part, that you can have. It will stimulate the digestive system and it will digest soon also. And you can have soups, especially horse gram soup you can have. It will give the protein nutrition to your body. And one thing about diet is you should have warm water. In this warm water also, our ancestors or everyone will say that we should have hot water. No, because any person, not only delivered woman, any person can't have hot water for every time when they have water, right? It will reduce the quantity. So you can have either warm water if you like, or you can heat a water or boil a water at once and you can cool it and you can have. That too, why warm water our acharyas advised is, again, same thing, as our digestive system will be slowed down. So to make it, to digest the easier form, they advised warm water. And this was about the diet and activities according to our Ayurveda. I didn't mention the particular points here. Overall overview according to our Ayurveda I mentioned. And even in our Ayurveda, they mentioned some medicines to follow in this 45 days. What are those? One is Jiraka Arishta, which will stimulate the digestive system. And another one is Dashamula Kashaya, which is Vata Shamana. And with Vata Shamana, it will balance all the hormonal imbalances. And Shatavari, what is this Shatavari? It will balance the hormonal imbalance, one thing, and another thing, it helps in the lactation. So this Shatavari you can have in any forms, like we have availability of churna or granules or syrup form, whichever you are comfortable, you can have. If you are having granules form, you can have with the milk. these are the some medicines. Actually, in my first session, I mentioned that till I explain the particular prakriti of a person, I'll not say any medicines, because if I say any medicine according to our Ayurveda, these all medicines will be dependent on particular prakriti of a person. If the reverse prakriti of a person took the medicine, then it will not, either it will not give result, or you may feel that this doctor said but we are not getting result. But here why I mentioned this medicine's name, because either it is not dependent on any prakritis. Everyone who is having digestive system problem, not only new mother, anyone can have Jirakarishta to improve their digestive system. It will create Dipanapachana and Dashamula. This is Dashamula, everyone. Even a lay woman know that after delivery they should have Dashamula Arishta nowadays, because many patients will ask. Directly they will call me and they ask, we can take Dashamula Arishta after delivery. So everyone have knowledge about this, that Dashamula Arishta is given for hormonal imbalance and Vata Shamana after delivery. And Shatavari also, everywhere we have knowledge about the Shatavari now, right? It will create lactation. So directly I mentioned medicines of our Ayurveda, that which you should take and what results we have from these medicines. And some points you should avoid after delivery. What is that? That is cold air. Don't use cold ACs, because obviously, as repeatedly I'm saying, there will be Vata dosha hampering. So if you use air, or if you expose to air, it will create again complications or side effects of Vata vitiated doshas. So you should not expose to air. Cold water, because again this cold water will hamper the digestive fire or digestive system. So you should not use cold water, and you should not take mental stress. Obviously, after delivery, every woman will be facing towards the hormonal imbalance, and they will be having the mood swings, right? So you should not take any mental stress. You should be happy, because according to your mind hormone only, the lactation or production of breast milk will be present, one thing. And you should, due to your improper balance of the hormones, it will hamper again your health. So you should not take any stress. You should be happy. And about sexual life, you can maintain, or you can start your sexual life after 45 days, or after the your body heals over totally, mentally and physically. When you are stable and when you are ready to have a sex, then you can move towards the sexual life after taking the permission or after taking the advice of your gynecologist. And this Abhyanga Svedana, everything also I explained for normal delivered people. But if you have any complications in deliveries, or if you had any issues in the deliveries, then once consult your gynecologist, then move further for procedures. So this was about the Ayurveda. Now moving towards the normal common tips to give about post-delivery care is, first of all, as we know, the overall body will be hampered in pregnancy and during delivery of a woman, right? So, but keep in mind, only 70 to 80% of your body will be regained after delivery. What if you follow all the tips and tricks of diet and activities? Overall, 100 to 100% of your body will not come back to a pre-pregnancy body conditions. Only 70 to 80% will be regained, that too if you follow the instructions. And another thing, instructions means you should not start immediately after delivery only, that my body got destroyed, I should be normal. Give your body its own time. It will resettle its positions as days goes on. Don't hurry up to bring back your body to a normal. It will take its time and it will regain. And another thing is, as in delivery, or normally in vaginal delivery, some 500, nearly 500 ml blood will be oozed out, or we will get lost. and in C-section, some 700 to 750 ml of blood will be lost. So by this, the woman will be very weak after delivery, for maybe very sensitive also. So some people will have very weakness, giddiness, everything due to this blood loss. So take care of yourself, one thing. And some will be having sleepless after delivery. That will be due to hormonal imbalance. No need to worry, it will regain its activities. And some women will be having teeth sensitivity. These also, as time passes, it will resettle. But if you have any teeth sensitivities, consult your gynecologist. They will advise you a calcium supplements. You can have it with according to your the dose, or according to your gynecologist, so that it will be regained to normal. And breastfeeding should be started immediately after delivery within 2 hours. And first breast milk, which will get the thicker form, you should not throw it or express it out. That is a colostrum which gives many antibodies to your baby. It is a first shot vaccine to your baby, so you should not neglect it. You should give. But if you didn't give for first 3 days, or if you didn't get the breast milk for first 3 days, obviously on fourth day you will get. Continue your feeding. Don't neglect or don't stop the breastfeeding. You should feed your baby. Because why I'm pointing out this, because nowadays women have that if we breastfeed, our complexion will go off, or our body structure will go off. But with this breastfeeding, your baby have many benefits through the breast milk, and even your body have many benefits through the breast milk. About this breast milk and benefits, we'll have a separate session. But what here I want to advise is, don't stop or don't avoid breastfeeding. As much as you can or as soon as you can, breastfeed your baby. Now coming for abdomen part, especially in pregnancy, abdomen will be getting enlarged very much, and muscles also will be getting enlarged very much, right? So after delivery, even after delivery also, for some days you feel like your abdomen is front only, your stomach is looking still fat, right? Don't worry, as time goes on, it takes its time, and it will go to its reposition in a few days. For example, the uterus will be enlarged bigger than size after delivery also. But as days goes on, nearly 14 to 15 days, it takes times to go for normal position. And with this, you can maintain like abdomen belt you can use, or this abhyanga, everything we will use, so it will regain its position. And about scars, many will be having common query that what to do for our scars, abdominal scars, right? Many people may say you that use that cream, use this cream, your scars will go. Will advise you many cosmetics, right? But remember, these scars will not go forever. They will be on skin lifelong, but they may shade for lighter forms as days goes on. Or if you use any cosmetics or creams, they may shade their color, but it will not go fully. The scars will not fade fully. And about this C-section scar, that stitches scar, you should maintain a hygiene in that part. And if you feel any pain or discharge, watery discharge or pus discharge from the stitches scar, immediately consult your gynecologist. And coming to the back pain or hip joint pain, as we know, in pregnancy and in delivery, this back and hip joint and the pelvic portion, these all ligament will stretch and they will become weak after delivery. So to correct this, one thing, leave the space timing to correct themselves. And another thing is, take a correct position for feeding. If you take a correct position for breastfeeding, obviously your ligaments or breast muscles will get support, so that they will be in a position and they will not cause any pain. And coming for leg pain, in initial days, you will feel a leg pain because as I mentioned, your muscles will stretch, so you will feel leg pain in initial days, but after some days, it will take its own place. And coming for uterus, after delivery, slowly, as I said, slowly it will take its time, in 14 to 15 days, the uterus will be back to its normal position. And about uterus, another thing is, while feeding or maybe while sitting and standing, you may feel pain in a uterus. It will be due to this position changing of uterus. As I said, it will be becoming big. As it slowed down its position, you may feel some cramps, or some may have some clots passing in a bleeding. So you should you should not, don't worry about that, because as days goes on, it will clear its everything, and it will regain its position. But uh, in an initial stage, if you have any smelly discharge, or clots are more, passing clots are more and darker in size, or if you feel that some complication is there, then immediately consult your gynecologist. And next point to explain is about urinary bladder. Immediately after delivery, within 4 to 5 hours, you should pass urine. Either you get ERG or not. You should pass the urine, because especially like when baby is passing, or when baby is pressing its head in a vaginal delivery, um, it will create pressure on a urinary bladder, so it may hamper its functioning. One thing in vaginal delivery. And coming for C-section, the urinary bladder should not come to or should not disturb in a OT or in a surgery. So what they will do, they will use a catheter to clear the urinary bladder, right? So it may get infections, or it may cause any side effects. So immediately after delivery, within 4 to 5 hours, you should pass urine. If you are not getting urine passed, you should inform your gynecologist, so that they will use your catheter and they will make the clear of urinary bladder. And after delivery also, for a few days, if you get ERG or not, frequently go and pass the urine, so that you will not get any urine infections. And next thing about is vagina. If you had a vaginal delivery, then obviously we know all the vaginal muscles, everything will be enlarged, and it will, by pressure, it will lose its elasticity, right? So if you are having vaginal delivery, it needs 3 months time to regain its vaginal muscle tone. And what about the constipation, right? Vaginal, after vagina, we will move to the anal canal. When obviously in vaginal delivery, if by giving pressure, the nerves in the anal canal will get ooze out, or the veins in the anal canal will get ooze out, and they will form a cyst-like form. If you had a repeated normal deliveries, the human can understand it, right? They will be having some muscle, like polyp or muscle swelling of muscles in the anal region after delivery. You will feel it, right? Nothing but due to pressure, one thing, and in repeated constipations, this uh, this, what is this, where veins will swell out, and they will form the polyp. You can treat it in the initial stage by using sitz bath. Even this sitz bath will help you in episiotomy stitches also, to heal it. And if you didn't treat it in initial stage, then it will form hemorrhoids or fissures, everything, and it will create a complications, and we should go for surgery. So instead of that, you can maintain your diet, fiber-rich diet, and water intake more, and you can prevent this constipation, and you can treat it in an initial stage. And how this bleeding will be, and for how many days the bleeding will be continued. Everyone will be having this question, right? First 10 days, your bleeding will be very red color, and next 10 days, your bleeding will be pinkish color. And after this 10 days, like 20 days, the excessive discharge will be normal discharge. Uterine till the uterine becomes normal. Obviously, in 14 to 15 days, the uterus will become normal. So our bleeding will become normal discharge. Or how many days it may continue? Some may stop bleeding in 1 week only, or some may stop bleeding in 1 month. Some may take 40 to 45 days to stop their bleeding. No need to worry. But after 45 days also, if your bleeding is not stopping, bleeding means only this 20 days will be a heavy bleeding. After 20 days, it will be like spottings or small amount of discharges till 45 days. After 45 days also, if your bleeding is continuing, one thing, and if your bleeding is having any smelly discharge or any like itching in the vagina, everything you have, then immediately consult your gynecologist. And next thing about the mood swings. Obviously, after delivery, every woman will be having mood swings, especially because due to imbalance in the oxytocin and prolactin hormones. So what this oxytocin and prolactin hormones, they are very much needed in pregnancy also and during the lactation also. But due to the hampering of this, the woman will be having mood swings. So to maintain your mental stress, you can follow meditation, or you can have your own time by giving your kid or baby to any family members. Overall maintain your mental health. That is, you should not take stress, you should be happy, so that your bonding with the baby also will be nice, and you can maintain your health also. Because new mothers will be having new like frustrations or responsibilities, or own me time will not be there, sleep will not be correct. So due to these all, ask help for your husband or family members and maintain your mental health. And what about periods? When you will get periods, and when you can expect your periods. So as I said, till 45 days bleeding is normal. After that, some may get immediately after 1 month regular menstrual cycles, they may get period, they may get. Some will not get periods till 6 months or 1 year. Usually in exclusively breastfed mothers, the period will delay. But remember one thing, your period may delay, but ovulation, not ovulation. You will be ovulating, but you will not have menstrual cycles. So you will be having chances of conceiving even if you didn't get your menstrual cycle back to normal. So take care of it. And this was about the routine care after delivery. What all complications you may get? These all are tips to maintain your daily routine. But what all complications you may face after delivery? That is, one thing, if you didn't breastfeed correctly, or if you have excessive production of breast milk, then your breast engorgement may be present, or it may convert to breast lump, or it may convert to breast abscess. Take care of it. If you feel that after feeding a baby still your breast is engorgement, express your breast milk, and you can store, or you can use as you want, or you can store in a bottle and you can feed that baby, but not more than 3 hours. And if you are having excessive breast milk, then give fresh milk only for baby. For every 2 hours duration, you should feed your baby. And after that too, if you're feeling engorgement, massage and give warm compression so that they will not form lumps. If you leave the breast to have a lump, then it will be created to abscess, and then you should go for surgeries. And if you have the pain in the, especially for C-section people, if you have any pain or any discharge, anything in the C-section scars, stitching scars, then immediately consult your gynecologist, so that they will advise you, or they will have the diagnosis, or they will have a visit on scars. And in normal vaginal delivery people, if you had a episiotomy, Then C for the episiotomy stitches and dryness of the stitches. And next thing is, as I mentioned, your UTI system will be very sensitive during this time. So take care of the you repeatedly pass the urine, and if you have any smelly discharge or burning in the urination, or if you have repeated frequent urination problem, then consult your gynecologist. And about last point is about myths and facts. We have many forms of myths and myths about this post delivery time. That is, one thing is diet. Take balanced diet. Don't uh, restrict your diet, because in our old age people, what they say, you should not have that, you should not have these, you should not have green vegetables. These all they will advise, right? Don't do that. You should have a balanced diet so that your health will be maintained. But your food should be in a light form, not heavy food. That's it. And about water, as I mentioned, don't have too hot water. You can have warm water, and you should have a lot of water. Your body needs lot of water to be hydrated. Don't restrict your water intake. Have 10 to 12 glasses of water per day. This also, the old people will say that you should not have more water after delivery. It's a myth. You can have a lot of water, because it will create hydration in your body also. It will help in lactation also, production of breast milk also. And about dry fruits, obviously all will have dry fruits after delivery, but by making dry fruits laddus for 1 month, you should not store it, and you should not have that stored one only. You can have small quantity, you can prepare small quantity, and you can have fresh dry fruits, like laddu in the form of laddus, maybe powder, maybe you should prepare freshly and you should have. And another myth is, you should have totally bed rest. You should not move from bed. It's not like that. How much active you'll be, that much active, or that much sooner your body will take its own position, older position. So be active in your comfortable or in your tolerating capacity way. Don't have too much bed rest. You should be active. And one thing advice is, you should not lift heavy, because has your uterus or uterine muscles will be in instability. You should not lift heavy. You should maintain that. And avoid lot of sittings. That is, if you sit for longer duration, as we mentioned, your ligaments of back and hip joint, everything will be enlarged. They may create pressure on your back, and you may be having backache if you sit for longer duration. So avoid sitting for longer duration. And maintain hygiene, especially in the vaginal part, and maybe for babies care, maybe baby cloth, baby bed, and your clothes, everything you should maintain hygiene, because you and baby both are in sensitive way, and will be prone for diseases. So you should maintain your surrounding clean and contaminated. You should not be contaminated. You should maintain hygiene. And when you can start exercises after delivery, that is, you can start in a C-section process, you can start normal walk or mild exercises from 3 to 4 months. And in normal delivery, you can start after 20 to 25 days. You can start a normal walk, light walk, and perineal muscle exercises you can start. And after 45 days, as I mentioned, you can start your sexual life. But another point you will come here is how we can control our family planning, that is next pregnancy. Don't take the normal pills what we use, like maybe unwanted 21 or unwanted tablets, pills. You should not take, because it will hamper your lactation and it will hamper the baby also. You should not take that. You can use copper tea, or best thing is you can take advice from your gynecologist, because rather than others advice, your gynec will be knowing what is your prakriti, what is your complications, and how is your health. So she will be the good person to advise you that how to follow and what to follow for planning. And the next thing is about the your mental health. That is, maintain calm, have a good sleep. If your baby is disturbing its sleep in a night time, have a sleep in daytime by giving your baby for others, so that your mental capacity also will be tolerated. You will not have frustration, and take care of yourself and take care of your baby too. This was a topic of Sutika Paricharya, that is post delivery care. We'll end the session here. If you have any questions or if you have any topics to discuss, you can comment in a comment section box. Thank you.